I am pleased to welcome Dr. Prashant Udge, consultant at Udge Child Development Center. And he's been DNB teacher at Yashoda Hospital and also guest faculty at NIMH. He's a fellow pediatric neurologist from Wadia Hospital for Women and Children. And he's published his case reports on familial acute necrotization encephalopathy with novel genetic mutation. He's also reported first case of PNP deficiency, and he's done a lot of studies, a lot of research. And right now he's the CEO and founder of Umang Institute of Autism and Multi-Rehabilitation Center in Latur. He's a secretary for Child Neurology Group of Hyderabad, associate member of Board of Genetics Telangana, and also associate executive board member for Association of Child Neurology. And he has an country head for Outstreet Vertical and special interest autism. We welcome you here, and we are really honored and privileged. It's our privilege to have you here with us, sir.
Yeah, thank you, Dr. Garima. Thank you, Dr. Ashish Chavan, sir, to create this platform and our complete elite group. So I think we have only limited time. So if I'm audible, I'll directly move ahead with, because within 5 minutes, we have to see what are the digital developmental disorders like post-COVID. Now COVID wave has come down, which physician has witnessed the rise in the COVID number, and there is decrease in a COVID number. But what, being a pediatric neurologist or a developmental pediatrician, I come across is the digital developmental disorders, or you can say it's a environment which is affecting this. So these are the many increase in the attention deficit hyperactivity disorder in a kids, then learning disability, then autistic spectrum disorder, and many more, speech delay and many other things which are coming across. So at our time, the more things were infectious diseases, but now it's more coming at digital disorders. So these developmental disorders are, we cannot say when it has started. It's very difficult to define the boundary at what age it starts, but we'll try to find out what are the things. So most common what I come across, where a parent comes to me from that, from school, the typical sentence what they use it: your child is not able to sit at one place and completely disturbing the whole class. That is the complaint from the teacher to the parent, which they come across. So we need to be have suspicious. Am I dealing with child with attention deficit and hyperactivity disorder? It's very, very common, and it's easily treatable with medication if required, therapies too. This is onset is usually before 7 years of the age, and impairment seen in 2 or more areas. Usually we see when someone like such kids get shouting or scolding in the school, even in their relatives and even at the home. So mainly 3 things we need to see: whether child is having inattention, is the child is more hyperactive, or impulsivity. Means they give the, like decide that they have to take this, means they will achieve that. So that is the impulsivity. Immediately they do it what they want. Hyperactivity, they don't sit at one place, disturb the whole class, even things won't be organized. So these are the few, and they make very careless mistakes. Their attention difficulty, sitting tolerance, attention, joint attention will be very, very, very problematic. They doesn't listen properly. They lose the things very, very frequently, very difficult to organize the things, and reluctant in doing some things, and always forgetful nature. Now, hyperactivity or impulsivity, they run very fast, very restless, not able to play quietly. Sometimes they do the fidgety movements. If you make the child stand and take tell an answer, always they will be having the body gestures, moving, fidgeting movements, and many more. They talk very excessively. They doesn't wait for their turn to come. But the symptoms vary from time to time. I don't go into the details, but one thing for the parents, they doesn't complete the schoolwork. Even homework, they won't be able to do it. So these are the few symptoms which we need to identify in a parent-teacher meeting, and even recently had a talk in a Little Flower group for the pre-primary and primary teachers. So means there is they are facing, this is a real problem what the school teachers are facing. So we need to educate the professionals like school teachers. Then second thing is educating the parents that this problem is not the responsibility of the school only, but jointly in association with parent and school, and taking the help from the neurologist or psychiatrist or psychotherapist. We need to take it, and this problem can be easily solved. Prognosis, most of the child, they improve around 70 to 80%. But if you give the proper treatment, and this is if someone want to identify who is he, you know, it's a Michael Phelps, and he was like gold medals in the swimming. Everyone knows learning disability. Now I'm from ADHD, I'm moving towards the learning disability. It's a very vast topic. And if you see Ishan Avasti and Amir Khan, you will come to know what this child was having. So learning disability has three main components. If child is having problem in the reading, we call it as a dyslexia. If the child is having a problem in writing, means orally he is good, but difficulty in writing or a problem in writing, we call it as a dysgraphia. If the child is having a problem in a calculation, we call it as a dyscalculia. So these are the major three things. And to give the example, this is a letter from Jody. And if you see how many spelling mistake he is doing it, but the meaning or the sentence framing is good. So this is a kind of dysgraphia this child was having. If you see the dear, TEACHR, but we could read the meaning of that letter. So they have the problem in their brain connectivity. That's where they develop this problem. And it's not their fault. But if teacher or parent doesn't identify that, definitely it's a fault. And one child from becoming normal, he may go towards the special school, or he has been like not given the exposure or opportunity to go towards the normal life. So we need, these are the general guidelines. I don't speak on this, but we should be aware that who can help you out is the child neurologist, developmental pediatrician, and then psychologist, behavior modification, and then like your remedial educators, and medication too. So for to give the example, how did they read? Like if the word is on, or for no, they will say on. For God, they will say dog, or for dog, they will read dog, like God. So it is vice versa. So they change the order of the letters, change the order of reading the letters. Sometimes they omit or add the words like aminal, animal. So they confuse with few words. So if you come across even in a Tare Zameen Par, if you see Amir Khan identifies that problem, Ishan Avasti is having problem because of his repeated same pattern mistake into that. And such kids, if you get a like proper treatment, remedial education, and whenever there is a ADHD, and if you give the medication to improve the attention, definitely child will improve. So what is important for the teacher is what the like kid with learning disability will say: if I cannot learn the way you teach, please you teach me the way I can learn. So there are different patterns. What Amir Khan teach this guy is the remedial education, the way they understand by using their all five senses, by touch, by visual sensation, by hearing sensation. So we need to understand how child is able to grasp the things and teach them the way they understand. Now, from learning disability, I'll move towards, so these are the few famous personalities who has the learning disability. One of them is the Albert Einstein, then Thomas Alva Edison, and these are all like famous guys. Now, most common what we are facing in our developmental OP is the autistic spectrum disorder. So what is mean by autistic spectrum disorder is the verbal and non-verbal communication affected. Usually human being interact with, first is the eye-to-eye contact, second is the language, what we speak commonly and understandable by both human beings, and third one is the body language. And along with they have the poor eye to eye contact. If you call them, sometimes they may respond to your call by name or they may not respond. Same guy will respond to the sound from the mobile, but the person next to him sitting and calling Prashant, Prashant, he won't respond. But the same guy, if he is used with the gadget and he listen his favorite song, immediately he will be alert and responding to that sound. So it is altogether eye to eye contact means non-verbal communication is less, verbal communication, that is speech delay, and third one is the repeated restrictive behaviors. I mean, sometimes they says the same repeated questions. Like if I ask, what's your name? He will repeat the same question. So it is echolalia. Sometimes they play with the object in a particular manner. Sometimes they watch towards the moving objects. So these are the few things. So if we come across such things, we need to be alerted. Why am I dealing with autistic spectrum disorder or virtual autism or a digital or acquired autism? So these are the few disorders which has very, very commonly we are coming across post-COVID, because the environmental modification in India has become significantly because of the isolation. Now there are nuclear family, husband and wife, and kid has been left sometimes with no choice by the parents on the A, B, C, D or complete rhymes or on a mobile or on a TV. So they adopt the digital frequency and they respond to the digital sounds, but it doesn't respond to the human beings. Reversely, but their IQ will be absolutely normal, and in few cases, their IQ will be little bit abnormal. So these are the few problems what we are coming across in a child in a school age, school going age. So what is the treatment for this? Early detection, early screening and early treatment with the therapies, with the medication. If the child is having comorbidity like hyperactivity, any vitamin B12 deficiency. And what we need to change is the change the environment, means more interaction, more human interaction, give the quality time to the kid. And then you will see if you stop the screen, there will be a significant improvement over the period of 2 to 3 months. Today morning only we celebrated with Indian Academy of Pediatrics, then Association of Child Neurology World Autism Day. This is a World Autism Month. Thank you everyone. Any questions are always welcome, and this is my number if anyone want to have interaction with me. I'll stop sharing my screen. Thank you.
Thank you for the wonderful presentation, sir. You were very informative, and obviously you were quick and you were dot on time. And I would like people to ask questions if you have any.
Prashant, we hear that there is a lot of what is the cause behind autism as such? Say, do we call it as a genetic defect, or what is the reason behind it, and is there something which we can do about it besides picking up earlier? Is there a way to prevent it?
Yeah, previously the major reason for the autism was genetic, but nowadays it is more of an environmental modification, which India or the complete world has gone through. So the nuclear families or a more interaction with the kids and less, like even WHO has come up with the guideline that no screen time below 2 years. And after 2 years or after 3 years, the screen time should be limited to 30 minutes or max at a time 35 minutes, not more than that. So more of a human interaction, giving quality time by the parents. And genetic, obviously one kid is having genetic affection and it's causing the autism. Obviously the next kid, the chances of getting autism is around more than 10%. And if the second child is affected, it is more than 35%. So that can be antenatally diagnosed and prevented with the use of genetic testing.
Thanks a lot, Prashant. I think before we move on to another speaker, that's an important thing, and we have almost blessed presence of Dr. Rahul Reddy, also an endocrinologist. We'll talk about it. Say one of the most important message which we need to communicate is our legal system is weak. we are pouring our children with Bonvita and Boost, which has got lots and lots of sugar in it. The way we have this, there will be a tsunami of childhood, what you call obesity in coming years. And the stuff which is being kind of, say, very simple stuff is Kinder Joy is banned all over the world, but it's very easily available in India, especially in our surroundings. And when we have both DIG group, that is the double income group, we have a children being left only and only to the gadgets. So future is scary. And the right kind of passing of information, immunization, and insurance. These are the three things which I look forward for a better society. So that's why we've had this kind of interaction here. And I congratulate Prashant, had done a fantastic job. Any question from anybody else? Otherwise, we'll move on to the next presentation, please.
Sure.
Dr. Garima, who is the next presenter, please?
Sir, we have Dr. Satish with us, the next presenter.
Before you introduce him, I would be very happy as he gets ready for it is myths in the medical practice, one of the very, very pertinent topic. And he is one of the very good orator, gentleman who's come from ISP, a very, very dynamic deputy medical superintendent and a very great colleague to work with. I would request Dr. Garima to come up with a formal introduction, and I would want everybody, especially the non-doctor people, to ask your doubts right now itself, as and when Dr. Satish stops his presentation. Over to Dr. Garima.
Yes, sir. Dr. Satish is Deputy Medical Superintendent and Senior Intensivist at Apollo Hospitals. He has done his EMBA, AMPH from ISB, Critical Care Specialist, Anesthesiologist, and Emergency Medicine Expert in Advanced Hemodynamic Monitoring and Management, Advanced Mechanical Ventilation Strategies, Management of ARDS, Severe Sepsis and Septic Shock, and Multiple Organ Dysfunction Syndrome. So he has a lot of research to his kitty, and today he's going to talk about just a second, sorry, cracking the myths in medical practice. Over to you, Dr. Satish. We are very honored and delighted to have you with us today.
Hello?
Yes, sir, you are audible.
Yeah, just give me 1 minute, Amma. I'm just adjusting
Sure,
my
sir.
laptop.
Sure, sir. Sure, sir. Meanwhile, I would like to add that Dr. Prashant has given us a lot of information about ADHD, dyslexia, and autism. I just want to give just a small addition of information. If you have any child suffering with dyslexia in your family, there's a very good school in Hyderabad, which is under the ages of St. Andrews. It's called Akira. And a lot of dyslexic kids are being helped there. So if anyone, really needs that support, they can be referred to Akira for educational system.
We would be very happy to
Bear with
have
me a
an
minute.
interaction at Akira, Dr. Garima, because we ourselves do not get.
So your voice is cracking, sir. Can't hear you.
All of us making.
Sir, can't like.
Sir, we can't hear you.
Dr.
We
Satish,
can't-
are you ready?
I could just hear that you said you would like to have an
You're
interaction
talking
with
about Dr.
Akira.
Ashish, you're talking about Dr. Satish, sir.
So Dr. Ashish, we couldn't hear you. You were saying something.
Talking about Dr. Satish or
Dr. Garima, I think we will ask Satish sir to start it because
yes.
there is
Ye-
less network
Yes,
connectivity.
Satish sir, I
That's
don't
what-
see him immediately. I think there is some.
He was here in the room.
Testing
he
1
was-
to 4, 1 to 4 to 3.
Yeah. I think he'll be back in a minute. So if anyone else would like to add anything, Dr. Anand is also here if he wants to add anything on these lines. Dr. Vanilla Raju, would you like to add anything?
Yeah, hello everyone.
Hello, sir.
Yeah, it's a very good initiative, madam. So many parents have been sending, and they are. Prashant Uted's talk was really good, sir. As you told, nuclear, we are also seeing many babies with deformities and all these issues. And Prashant Uted and I have been associated more than 2 years now, doing very good work in cerebral palsy and developmental delays in kids and all that. So yes, it was a very nice, simple presentation. And actually, all these talks that we are doing today are not to actually enlighten or give you so much knowledge. It is only to give a simple gist of things that if at all you feel something is wrong with your kid or whatever, the, like, talks we are giving are only for awareness.
Sir.
So,
Yes, sir.
so,
Yep.
so each of us have prepared very simple PPTs so that a common crowd, like any person in the world, can just log in and listen to it and understand what is right and what is wrong and what is happening in the medical field. As a society, we should be more aware of information that is true and what is false, because these days the advertisement media and what do you say, the news channel media is also is just made for an entertainment channel. So I feel we
Uh,
are the people who have to take it further, making sure that
That's
we give
That's
right
very true, sir.
information.
That's very true. So
Satish
thank
sir
you
has
so much for
joined.
your inputs.
Yeah.
Dr. Satish has also joined in.
Oh, great.
Sir, we are waiting to hear from you.
Yes, Satish sir, please take over, sir.
Satish sir, please unmute yourself, sir. Yeah.
Am I audible?
Yes, sir. Yes.
So I'm sharing my screen.
Yeah, just a second, sir. Yeah, you can share now, sir.
Yeah, doing more, yeah. Okay, is it visible?
Yes, sir, it's visible.
Yeah. So good evening, everybody. Thanks for giving me this opportunity. Thank to Ashish sir and Hyderabad Elite doctors and Garima. Thank you very much. So my talk is just like to make the people to understand what is really happening in a hospital, because there is a lot of like medical mafia myths are happening, and people are misunderstanding the medical practice and unmissed, and there is a lot of gap is establishing between the medical system and the general public. So my intention is to make them to understand what really happens in an ICU and in a hospital. Okay, so myth one: why the treatment in corporate hospitals or ICU is very costly? Okay, so hospital is like a doctor is a person who can get a diagnosis either in the way of clinical aspects or looking into the investigations, and a combination of these two. So investigations nowadays, due to the development of technology, it is going to a point of requiring a lot of instrumentation, equipment, MRI, how costly the machine is, and in non-invasive procedures, like cath lab establishment. So much of establishment is putting in the healthcare units, and once the patient is asked to get that investigation, obviously the investigation seems to be costly. And patients also previously, when compared to the olden days, present days, they require a lot of comforts like AC rooms, AC maintenance, 5-star food accommodation. So hospital care is now attached with hospital and a supportive care like a 5-star treatments. So it is almost like you are getting your treatment in a 5-star hotel. Imagine that 5-star hotels are very costly. So similarly, why it is costly? Because they maintain the standards, they maintain the quality, they have a lot of infrastructure, they have a lot of very good high standard equipment, and almost like even there is the machine is working or not, we have to have a fixed cost on that machine. And variable charges is when the patient is coming and it requires some dye equipments, some electrical substitutes, all these things, like who will bear this? So the better the treatment, better the investigation procedures, obviously it will be costly. It's not that something is going into the doctor's pocket or something is going into the owner's pocket. It is for the maintenance. And nowadays, everybody is looking, like even for the insurance companies also, they're asking, did you get the accreditation for NABH and joint committee accreditation? So all these things, they have particularly look into the quality indices of the hospital. Okay, so when the quality is to be met, we need to shed lots and just a minute and నేను క్లాస్ చెప్తున్నానమ్మా, క్లాస్ అయ్యాక వస్తా. Sorry, slides are not moving. Sorry, slides are not moving. I'm resharing my. Can I reshare it?
Sure, sir, sure.
Slides, I don't know why they are not moving.
So you can reshare, no problem.
Okay. Yeah, corporate hospitals do unnecessary investigations. This is one myth. Actually, it's a myth. See, if we don't do the investigations, how can we get a proper diagnosis? So we are not like olden days, like Rishis are having them third eye, they can look into something which is like Divya Drishti. We don't have the Divya Drishti. So what we call it is we have to get through the investigations. For example, like a patient who is known to me, another patient who is completely not at all in relation with me. So my friend or my known patient comes to me, asks for some headache. I just give an analgesic and tell him that just observe for 2 to 3 days. If it is okay, otherwise you don't need to go to higher investigations. So he will be okay, take this medicine, go home, trust me, and he went off. After 2 days, he might come back with, okay, doctor, my pain got relieved, and maybe he might come back with, doctor, still the pain is there. Then I would suggest him to go for an MRI. If an unknown patient comes to me, if I send him back with simple analgesics and he lands up at a complication, he immediately sues me. He will take me to the court of law, and law will ask me, why have you not properly investigated this patient? To safeguard the legal implications, to prevent us to having heavy penalties or punishments, we need to look into that investigation, and then only we can clarify that whether it is a severe form of headache, any complications are there, or it is a simple headache. So this is why we want to say it's all patient driven. So it is not previously olden days the patient used to trust the doctor and do accept whatever the doctor says. Nowadays trust factor is not there. To need to have a supportive evidence, we need to have certain investigation. If the investigation for the headache is MRI not showing anything inside the brain, patient is safe and I am also safe. So that's why we ask for investigations, not for the sake of just for doing. We want it to be, sometimes we have to rule out certain diagnosis. Okay, so then comes to, I urge all the patients and their family members should understand what is the patient condition, what is his basic medical aspects. See, a patient comes to me and my spending time in the emergency is not more than 5 minutes or 10 minutes with the patient. But thing is that I get the information from the family, I get the information from the existing records, whatever the patient says. So all these things I need to assimilate and get back to a common information that what is happening in this patient. So we have to have a present condition is how sick he is, how many systems are being involved in this patient, like how the neurological system, how the hemodynamics, how the vascular system is involved, how the kidney is working, how the liver is working, how the blood parameters are going deranged. So these things we need to look into. So present condition is very important. And what is the past medical condition? Maybe this patient might be suffering with asthma, suffering with hypertension, diabetes. Those things are not simple diseases. They will have a chronic insult on the patient. Though they are maintaining good with that medication, but still there is an underlying pathology is running in the body. And how many organs are being destroyed now? How many organs are under the stage? Some patient comes to me with low BP and this kidney is not working properly, his liver enzymes have gone up, his outer sensorium. So it's like number of organs involved directly proportional to the risk. The higher the number, higher the risk. Then what could be the possibility of survival in this patient when he came to with these many problems? A 90 years patient with heart attack, and now they're having a background of diabetes, hypertension, all these things. So what are the expectations? He's not equal to a person who is 20 years old. So this is what we have to understand. So how much we need to understand what is the possibility of survival of this patient having these many problems, and what is the significance of each deranged laboratory. Some are reversible, some are short term, some are permanent changes. So permanent changes, we can't get them back. So myth 4 is always some people come and look into the Google and come to us and ask and discuss with certain things. Medicine is not as simple as that. So we struggle a lot, more than 10 to 12 years to understand the disease process. And we can't tell each and everything to the patient in 5 minutes. And if patient has to, or family has to understand the patient condition, he has to go through the medical, medical school and get the training for at least 10 to 15 years. It is not that simple to explain them in 5 minutes. Okay. So you can Google it to understand the things, not for the finding fault. You can Google it, understand the process, come back to the doctor, discuss with him what are all the process, but be relevant in questioning. We can't question like whatever that comes into our mind. Be relevant to the patient, to the condition, and every doctor is ready to answer those things. And always better to involve a known doctor who is like your family doctor, a family physician, or a cousin, or a friend, somebody who is actually interested. See, most of the times what things happen is, you tell them that one of my patient is there in Apollo hospital or some Yashoda hospital or Kim's hospital, whatever it is. Then he feels that it is burdensome and he asks that just simple phone call. So simple phone call does not give the solution. If he's really interested, ask that person to come see the patient, discuss with the doctor. So otherwise, no, there is no point in talking in the phone, because when you see something, you will get a lot of information. You cannot go with some figures like BP is how much, creatinine is how much. That is not the thing. You come see the patient, discuss with the existing doctor who is treating the patient, then come to a common conclusion, and which is for the betterment of the patient. And if not, ask for a brief summary. And that summary can be taken to any other doctor and show it, and they can have a second opinion. Always we welcome a second opinion. Better avoid a phone calls and phone opinions. Give time to the doctor to treat the patient rather than simply discussing. First, one family member comes, ask about the patient. Another, my brother came, please again explain what is happening. Then my sister is in US. Can you tell her in on phone? Then my mother is at home. Can you have a video call? So how many times this doctor has to spend the time with talking to the family rather than treating the patient? So try to avoid these things. Then fifth myth is procedures and treatments have risk. Yes, every procedure will have a risk, because otherwise it can't be called as procedure. So simply example, when you take a two-wheeler and going on the road, what is the probability of getting an accident? Yes, there is a probability of getting an accident, but it is very less. Similarly, every procedure will have its own risk. It's only the percentage difference. Okay. Life is a balance between a risk and benefit. See, if you want to go to America, you'll get lots and lots of money because of your profession or whatever it is. But going to America, 14 hours of flight journey, anytime it will fall on the Pacific Ocean. And every day we read some newspaper that flight crashed or this flight crashed. But are we not taking the risk? We are taking the risk and going. Similarly, always have a balance between the benefit what we are getting by taking the risk. We are taking the risk of going to America by flight, but once you reach the America, you will get a lot of money and respect or your job or whatever you want. So for that benefit, we are taking the risk. Similarly, if bone marrow is done, if some injection is given, yes, injection pricks the body, you have a pain, but that injection will take care of your disease. You will get better out of it. So always weigh the balance between the risk and the benefit. Then sixth myth, medications have side effects. Obviously, every medicine is a chemical. Every medicine have its own pharmacodynamics and pharmacokinetics. Example, like you take pani puri and you will get diarrhea. Whom will you ask? You simply shut your mouth and just enjoy the diarrhea. That's all. Nothing more. You can't go back to the diarrhea guy and the pani puri guy and asking, was your pani puri made me to go for lot many diarrhea stools? No. So you never bother about having a pani puri, but you're asking paracetamol. Such paracetamol causes liver damage. Okay, I know that, but thing is at what level it causes liver damage. Paracetamol is the only medicine to control the fever. The advantage is controlling fever. Disadvantage, some people may get a liver failure beyond a dose of 4 grams per day for longer periods. I know that. Knowing that also, but there is no other go. Every medicine will have its own side effects, but take the advantage of the efficacy of the drug rather than looking at the side effect. But there are life-threatening side effects we also don't take. But it is like evolving. What is that called as science? So we are all eagerly waiting for a vaccine. Vaccine came for COVID. We all took vaccine, but people are now telling that vaccine is the culprit for all these new young deaths. Who knows that? It's all changing literature, changing knowledge. So we don't, whatever that is there in the literature only we can talk. Otherwise, we are not gods or we are not Maharishis to have our third eye. And so we are not born with any this thing. We are only learning through going through the literature. So every medicine will have its side effects, but we know that we give that medicine for the sake of the benefit because the side effect is not that much of life-threatening. Understand? Next comes recovery is good or bad. So this one thing, like patient came to us with very, very bad stage. He is high likely chance of dying, but somehow we could able to pull him out after 5 to 6 days of our exercise, our cooperation. Patient is everything recovering, and ultimately at the end of the day, the bill mounts to some lakhs, and you go out of the hospital with a safe, recovered patient with an empty pocket, and you will feel sad out of it. It's a celebration of unhappy moment. Try to understand this. You are okay, but still there is something pricking you that you lost so much of money. You are sick enough. You're psychologically, you're physically, you're financially sick because you lost money. You spend some bad time at the hospitals, all this. Imagine that the same thing happened to you go to any hospital, any other center. You are working through the office. You are not trying to get some information, but nobody is there to help you. And at one point of time, I'm sorry to say, unofficially, you bribe them, you do recommendations, you do use all your influences. Ultimately, a long-awaited thing suddenly cracks out, and you get the good information that your work is done. How will you feel? You will feel very happy. You feel that even you say that even though a lot of money is lost, but I finally got my work done. So that is the happy celebration, but recovering from the illness is celebration of the unhappy moment. So there is a lot of suffering, there is a lot of expenditure which makes you, but try to understand that you are going with a patient who completely recovered from his bad illness. That is only because of the healthcare system, doctor and hospital. Don't forget that. Myth 8. Doctors don't care the death and suffering. No, it is a myth. If a patient we treat and we lost that patient, the first person who actually suffers by losing that patient is doctor who treated, because it's a great insult for us. It's a failure to us. We can't accept the failures. If that patient improves, then that gives a very good gratification rather than taking money, anything. Like patient recovery itself gives a lot of satisfaction. So never think that we don't have feelings. We also have feelings. But thing is, we are not gods to save everybody. So try to understand that we don't be in a like idea that we don't care the death and suffering. We also give a lot of importance to death and suffering. It's not the only family members, even we also give it. Myth 9, doctors are minting money. It's very, very unfortunate thing. And they always say in COVID, medical mafia. So doctors start earning after 13 to 15 years after their +2. So 5 to 6 years of MBBS, 3 years of post-graduation, 3 years of doctorate. So all these things will take 15 years of his education without having any earnings. Roughly after 30 years of his age, he's having an settlement. So proportionate, and this is also, if you work on that day, you will get money. If you don't work, you don't get. It's a proportionate earnings. I remind you that many doctors died when treating COVID patients. No, highest number of more than 700 to 800 doctors died in treating. If doctor thinks that I have enough money, I don't want to earn. If we don't treat the COVID patient, what will happen to the COVID patients? Try to understand that. So nobody is for money. It's a passion job. We treat the patients, we get good satisfaction if the patient survives. We felt very guilty if the patient dies despite our best treatment, but this is the game. Okay. In our country, the life expectation of a doctor is, try to understand, it is 10 years less than the normal average person of that age. So doctor's life is at risk because of their stress and strain. Myth 10 is treating a dead patient for many just for the earnings sake. We keep the patient in the ICU. Patient is dead, still patient is on ventilator. There is no necessity to mint money like that. We are getting enough money. Hospitals are running full. They don't want to maintain a dead patient in the hospital just for the sake of money. It never happens in any hospital. So what I request or what my suggestions are, what are the take-home messages? Ask to know, not for finding out fault. You have every right to talk to the doctor and the personnel who is taking care of the patient, just to know about the patient condition and prognosis, not for the sake of only suspicion. We welcome always a second opinion, which should be a constructive second opinion. Accept the reality, half glass empty sometimes, and you also think that half glass is full. So we might tell you that half glass empty, you might take it as half glass full. So my patient is sick means, yes, he is sick. But you are telling that, no, doctor is frightening us. He's otherwise stable. Why is telling very sick? why he's telling critically. So that's what the perceptions are different. Medicine is an art of applying science with the use of technology under the framework of evidence-based approach. Try to understand every word in the sentence. It's an art. Medicine is not a simple science. It's an art, basically Bachelor of Arts and Bachelor of Science. Okay, it's an art applying science with the use of technology available. Okay, at one point of time, maybe this ChatGPT and AI will come and replace doctors at one point of time. You might expect this may happen in coming 5 to 10 years. Doctor now is not necessary. All your computer will treat you. Okay. And no two patients are similar. 2 into 2 equal only in mathematics. In medicine, it can't happen. 2 into can be anything. Not always. In medicine, it cannot happen. So you may say that the same similar complaint, my neighbor 2 days back he got admitted in X hospital. Within 2 days, he got recovered. And why this patient is taking 5 days? Common question we come across. So no two diseases are similar. No two patients are similar. The triad you should understand, it is not that only doctor, it is the patient condition, it is the medicines what we are giving, it is the bug or infection what is happening there, and this is the triad, that is the doctor who is treating, doctor plus treatment, environment, from which environment is coming. He must be having what bug, what infection, then the patient condition itself. A patient with 20 years without having any comorbid is not equal to a patient is 90 years having diabetes, hypertension. So disease is the same, but the patient factors are different. And now even in the advent of robust literature, as per the medicine, human mechanism, we know only 10%. Try to understand this. We are not gods to save every patient. Then professional satisfaction is more gratifying than earnings. Always, all doctor will think in the same way that professional satisfaction is very important. We never bother about our earnings. Then emotional attachment to the patient we to have. If I treated a patient with utmost difficulty, with all my best efforts, and ultimately I lost the patient, the first person who suffers that loss is me. I feel very guilty that despite my best efforts, the patient is died. So reconciliation of the death of the patient, we again go back to the literature, we discuss in the forums, we try not to continue the same level of treatment. We get more information, more literature, and we implement the similar patient comes. We have to upgrade ourselves by having a good knowledge, attending to CME, symposium, all these things. Okay. So we are also human beings. We require food and sleep, who have a personal life and a family life. So don't think that expectations like doctor should come in the night, midnight, 2 o'clock. We also have family. We also have to sleep to have our next day work. Finally, the paradox, healthcare is a business. You try to understand that medical profession is now changed. It is a business now with the corporate hospitals. And in that, doctor is the service provider. Okay. If the flight crashes, the pilot is the main person. If the problem happens, if the doctor is the main person, you all think that he's the culprit. Try to understand that it is not, it's the system. And I advise all of you to have a health insurance. It's nowadays, it is very, very compulsory. Trust your doctor to give you the best. That's all. I am ready to take any questions. Thank you.
Thank you so much for the wonderful presentation, sir. It was really nice and people have really appreciated your talk. There's a appreciation from the audience which says very excellent way of explanation, doctor's feeling and medicines. Really appreciated, Dr. Satish.
Thank you, madam.
Anyone would like to add anything here? Lots of thumbs ups are coming. I think you have actually, a lot of people have felt the way you feel and they really appreciated it. So thank you so much, sir. Thank you. I'll just wait for a minute if any questions are coming. If not, we are going to go to the next presenter.
Yes, madam.
Okay, so no more questions, sir. Thank you so much. And we are delighted to have our next presenter, Dr. Vijay Karan Reddy. Are you there in the room, Dr. Vijay?
Yeah, I'm here.
Yeah, good to have you here. Dr. Vijay Karan Reddy has an experience of 7 years in radiation oncology. He has completed his MD in radiation oncology from Cancer Institute, Adhya, Chennai, and fellowship as physician observership in proton therapy at Apollo Proton Center, Chennai. He has a Pediatric Radiation Oncology Fellowship, MD Anderson Cancer Center, Texas, US. Pediatric Oncology Fellowship in Baylor School of Medicine, University of Texas. Pediatric Neuro-Oncology Fellowship at Christie, Manchester, UK. We are really delighted to have you with us, Dr. Vijay, and he's going to talk about the fight against cancer, how to win. Over to you, Dr. Vijay.
Thank you, Garima, for the wonderful introduction. I just wanted to know, so most of the crowd here in this forum are doctors or the general public also?
It is a mixed crowd, but later is going to go on YouTube also, so you can treat them as a general public.
Okay. Would you prefer that I have a presentation? I can, or
Any way you are comfortable with. I've
Okay.
given you the co-host rights, so you can go the way you want to.
Okay. So I think always, pictographic memory is much better than what we hear, especially on Zoom. It is better we
Yes,
show some
that's
pictures.
really true.
Yeah, just give me a second. I'll share my screen.
Even Dr. Satish presentation, I can still, visualize the points he
Yeah.
said. So for the listeners who have joined little late, we are talking about World Health Day, and we have finished a talk by Dr. Prashant, who has talked about dyslexia, ADHD, and autism, and then the talk by Dr. Satish, myths in cracking the myths in medical practice. And now we have Dr. Vijay Karan Reddy with us, and he's going to talk about cancer, how to win the fight.
Sorry, I just updated my laptop.
Yeah, no problem.
It's taking some time.
We
Meanwhile,
have the
if some...
privilege of. Am I
Yes.
audible?
Yes, sir, you are audible. We are missing you, sir.
Oops, I'm missing the blessed, beautiful weather is distracting me everywhere. So I think this is the time we should use it to talk about the the problems with technology, because now chat GPT and AI is in the scene everywhere, and we need to understand, because people soon the plan is to replace doctors with the robots, which is absolutely fine with me. The only thing is humanity is at stake. So yes, and that is where we see that how technology can cripple you and me. It's all about knowing that Google, science, technology, and money, they need to be the best servants, but very, very bad masters. And we can see that happening here right now. So when the patients come, I really enjoyed the talk of Dr. Satish sir, and I would take on it again. And I'm really happy that, Vijay Karan is back with his blessed slide, which both of us have shared so many times, and which communicates and connects us very much nicely to the normal population. So over to my very great friend, Dr. Vijay Karan Reddy, so that we'll have more discussion about chat GPT and AI once we are done with his presentation.
Yes. So I'm ready. I'll go ahead and start, Dr. Garima. I hope you can hear me as well.
Please go ahead. Please, we can hear you.
Yeah. So Ashish sir strictly said 5 minutes, so I'll try and keep it as quick and simple as possible. So see, because you said there is a mixed population, and this is something that goes on YouTube also, just to give a fair idea about, because we keep hearing this word cancer a lot. So just trying to understand what cancer is. So all cells in our body have the capacity to divide, right? And this division is controlled by a particular set of genes which tell the cell to either divide or to stop or to die. So when there is a mutation in any of these genes, these cells undergo uncontrollable division, and that is what causes cancer. So cancer again can be either benign or malignant. So benign cancers are tumors that are formed only in that particular area where there's uncontrolled division. when a benign becomes malignant, it has a tendency to spread to other parts of the body. So usually when we say cancer, we usually refer to malignant cancer, and the stages of cancer also are accordingly placed. So to understand the burden of cancer, right now the latest consensus says in 2020 there are about 14 lakh people newly diagnosed cancer cases in India alone, and this number is expected to by 2025 to reach about 15 to 16 lakhs. So that is essentially the most, to give you a fair idea, breast cancer, because I'm talking about breast cancer because it's the most common cancer. 1 in every 8 women have the tendency to develop breast cancer in India alone. So that gives you a fair idea and the seriousness of this disease presently in our country itself. So the steps to fight any disease. So now everybody is a doctor. So these steps everybody can recognize, especially post-COVID. So prevention, early detection, that is, even if you get your symptoms, make sure that you go at the right time so that it can be controlled and cured. And at the end, even after you get diagnosed, get the appropriate treatment. So all these three together work synchronously and step by step to, to help us fight this disease. So 85% of the cancers are all lifestyle based. A lot of people, a lot of my friends, when I go to social gatherings, ask me this question, that why are the number of cancers are increasing? Because of, there's so many different factors around us. A factor as simple as Swiggy, because we have the tendency to have outside food, easy access to outside food. A lot of people are surviving on that food because they don't have work time to, cook food for themselves. The urbanization, the construction, the city, the way each of our metropolitan cities are going, the population is increasing. So there are so many factors around, including the environment that we live in, the air that we take in. So all these factors together combine, and that is the reason why the incidence of cancer is increasing. Another important factor is that everybody is realizing the importance of diagnosing cancer at the right time. So there is more awareness among doctors as well as among the general public. So there are more and more registries coming in, so that will help us track the incidence of this disease accordingly. So like I said, 85% of them are all lifestyle related. So the best way to fight cancer is to change your lifestyle. So some of the small ways that you can change your lifestyle, first and most important, the most important causative factor of cancer is, as we all know, we keep seeing in every other movie also as a warning, smoking and alcohol. So if you cut all the people who are regular smokers and who are addicts of smoke, even if it is secondhand smoke, if you have somebody in your community, in your house smoking, whatever it is, try to stay away from smoking and non-smoking, smokeless tobacco also. These are the misconception that many of the people have is smoking causes lung cancer. It does increase your risk of lung cancer. That is the primary thing that you need to keep in mind. But smoking affects every single type of cancer in your body in some way or the other. So it is a causative factor for almost all types of cancers. Like smoking affects each and every cell in your body and causes so many health diseases, same way it has a propensity to cause every other type of cancer also. So staying away from smoking and alcohol is one of the the most important steps towards fighting this disease. As soon as I say stay away from alcohol, I think everybody will start hating me. So I will give that is a broader picture. I'll give a clearer picture. So having about 120 to 180 ml per day, about 3 to 4 times a week is still okay. So anything more than this, if you're having, that means you're an alcoholic, and that will be detrimental to your health. Apart from removing the causative factors, that is being aware of your environment, being careful about where you live and where you work, staying away from smoking and alcohol, the next best step is your diet. So when it comes to diet, this is a very busy slide, so we don't need to go about each type of food, how it prevents each type of cancer. To have a broader idea, simplest thing is you need to have a balanced diet. A balanced diet comprises of food which is rich in fruits and vegetables and less of meat and processed foods. So in this slide, as you can see, you have to have foods which are rich in all the vitamins, low fat, low calorie, and high fiber. This keeps your general health and your immunity at a good status. Next step. So being physically inactive, being obese are one of the major causes of cancers, especially in women. So being physically active means now it has made it very, technology has made it very, very simple for us. Everybody has these smart watches and trackers, and everybody's looking at doing 10,000 steps a day. That is a very, very good start. The reason why they do 10,000 steps a day is also that is a recommended amount of activity that you need to keep your heart healthy. That works in every other way as well. So the American Heart Association also recommends doing at least 1 to 2 hours of exercise a day for about 5 days a week. So just while working itself, even if you don't have the time to do any particular gym, or you don't have to go to the extent of lifting weights and building your body, just being physically active with minimal physical activity during the day, 1 to 2 hours of work, a walk, a run, or even, walking around your house, around your compound itself makes a huge difference. Moving on to early detection. So the next step in fighting cancer is early detection. This can be done by screening. Any screening test that we do, the most important thing that you need to identify is we make sure that it is easily affordable and easily accessible. So two of the most important screening tests concerning women, I would say, breast and cervical cancer are the most common cancers, right? So for breast cancer, we do mammogram, and for cervical cancer, we do pap smear test. For pap smear age, there is no age or a high risk group that we look at. Any woman walking into a gynecology clinic has to undergo a pap smear test. The next comes mammogram. For any woman, present recommendation is for any woman above 40 years of age, and yearly mammogram has to be done. If you have a family history of cancer, that is your sister, your mother, your grandmother has breast cancer or ovarian cancer in your family, then you have to start screening yourself at the age of about 35 years. So this is some of the common tests that we do for cancer screening in women. So the next step comes into cervical cancer. So cervical cancer, like I said, pap smear is the simplest test. Here it is, a pap smear is the simplest test that we can do. Usually once we do a pap smear, we do once every year. Consecutive 2 or 3 pap smears being negative, then you can leave it, and unless you're symptomatic, you don't have to repeat it. But you have to start doing pap smears at the age where you start your sexual activity. So as early as 2021, any woman that is walking into a gynecology clinic has to get a pap smear done. It is very accessible. Any gynecologist can do it, and it is very, very cheap. Patient will not have any discomfort. It is just a 2-minute OP procedure. Here it says a single pap smear itself can reduce the risk of cervical cancer by about 25%. So there is no high-risk group. All females attending the gynecology OPD has to undergo a pap smear. Some of the other steps that you can do to prevent cervical cancer, again, as you can see here, quit smoking. Next, apart from screening cervical cancer, the other important way, another short way that you can prevent the cancer by more than 90% is getting a HPV vaccination. So any girl that is 9 years and above, 10 years and above, getting 3 doses of HPV vaccine was what was recommended initially. Now that has come down to 2 doses, and now the latest guideline says only 1 dose. So just 1 dose of HPV vaccine can prevent you from getting cervical cancer anytime in your life by more than 90%. Again, getting HPV vaccine does not mean that you don't have to be screened. You still have to be screened because it's not 100% guarantee. Just like your COVID vaccine, different vaccines that we have, each vaccine has a different efficacy. That does not mean that you will not get COVID at all, but it reduces your risk by more than 80 to 90%. Some of the common symptoms of cervical cancer, bleeding, discharge, and pain are the most common symptoms, especially in postmenopausal women. Most common cancer and also the most preventable cancer. So breast cancer, I will not dwell too much into it. That is what I mentioned before, that mammography is the screening method to follow. So moving on from women cancer, the next most common in men are 2 cancers, lung cancer and head and neck cancers. In head and neck, oral cavity is the most common. Lung cancer, like you all know, any person who's a smoker, that somebody who's been smoking a pack of cigarettes, that is 20 cigarettes a day for more than 20 to 30 years, is a very high risk of lung cancer. So these patients above the age of 50 years have to undergo a screening CT scan yearly to understand the changes in their lung and to understand the risk. For chewing tobacco, anybody who's a tobacco chewer and any ulcer or symptom that he sees, there is no screening method as such. However, as a screening method, we do examine your oral cavity People who chew tobacco undergo constant changes in their mucosa within the oral cavity. And it is very, very important for them to, first step is to stop tobacco completely. The second step is that you have to keep getting yourself checked for every small minor change or symptom that you have. So this is breast cancer mammography. And the other part of breast cancer screening is self-breast examination. Self-breast examination is something very simple that you can do. Every woman at home can themselves see once a month at least, feel their own breast with the tip of their hands, and just move their hand around the breast up and down and round and round. And this itself can help you feel a lump. And if there's any doubt that you find, then you can get yourself screened with a mammogram. This is the age recommendations and the screening recommendations that we have for women with breast cancer. So I spoke to you about lung cancer already, how to screen. The next comes treatment. So in terms of treatment, that two advantages to you following the preventive measures and the screening measures. One thing is, obviously, you catch it at an early stage, it is highly curable. Second thing is the treatment also will be simple for you. So when you catch it at an early stage, you can get away with doing single modality, that is only radiation or only surgery. But when it is a later stage, locally advanced stage, then you'll have to undergo through all three different types of treatment, that is surgery and most probably radiation and chemotherapy as well. So the different types of treatment also I have mentioned in some of my slides. So three main treatments that you need to understand: surgery, chemotherapy, and radiation. Depending on the site of tumor, the stage of tumor, your oncologist will decide what treatment works best for you. It is either we use either of these three treatments, or we use them in a combination of all three as a sequential treatment. So the oncologist will make the decision for you to decide which treatment is best and which treatment would give you the best chance of cure. Beyond the chance of cure, the next step, the latest advancement that we are getting in medical therapy, that is targeted therapy or immunotherapy. Immunotherapy is one big word that you keep hearing a lot these days. Right now, immunotherapy is not recommended in the curative stages of treatment. All the curative types of cancer are treated with surgery, chemo, or radiation. Immunotherapy right now has indication only in stage 4. So even in stage 4, trying to alleviate the symptoms of the patient, control the disease of the patient, and extend the life of the patient without troubling them, immunotherapy has come a long way, helping them prolong their life. Targeted therapy also has a similar function. We can prolong the life 2 years to 5 to 6 years also in some cases, just with targeted therapy, immunotherapy, even though you're detected in the final stage. These are different types of radiation. The latest technology that we have is called proton therapy. This is the most advanced radiation therapy that we have. And this does not improve your chance of cure, but it is very, very precise treatment. And the chance of your side effects with radiation that you usually get are cut down more than 20 to 30%. This is how a radiation therapy machine looks. And this is some of the brachytherapy applicators. The chemotherapy I've spoke to you about. Some of the common side effects of chemotherapy that we see, most common, everybody is worried about, is hair loss. What you need to understand is hair loss again is not permanent. It is only temporary. Once the chemotherapy is over, the patient does get back their hair. The rest of the side effects like fatigue and nausea, vomiting, more common side effects, all these can be controlled with when you follow the advice of your oncologist and your dietitian. I told you a little bit about targeted therapy and immunotherapy as well. So what I've shown you the steps on how to fight cancer, how to prevent it. So preventing is one step, but what I need, the message that I want to put across more is that even though you do get diagnosed with cancer, there is nothing for you to worry. There's so many different, treatments and newer technologies that are available, whether it's stage 1 or stage 4, we can still take care of you. And even when your cancer is curable, life after cancer also is possible. We have had patients right from children who are 1 year old to men and women who are 60, 70 years old also. All of them do have a normal life post-treatment. So the best example that I can give for life after cancer is we had a 31-year-old lady who was pregnant with a 3-month-old baby who had breast cancer. So we had to abort the child. Then we gave the treatment. She's cured of cancer, and now she is have a healthy baby, and she's living a normal life. So yeah, that's about it. Thank you so much again for the opportunity, and thank you, Ashish sir and Dr. Garima, for having me.
Fantastic presentation as expected. Is my voice clear, please?
Yes, yes, sir. Thank you.
Great.
Sir.
Any questions from anybody? Vijay, I would expect that you should be right and I should be wrong. That,
Yes.
180 ml is accepted. But as per the present guidelines from Indian side, the scenario, it's not acceptable. The men and the cardiologist will not agree to it. But I
Okay.
really pray that there will be some study which will come, which will prove you right. So if it is right from the point of cancer, probably okay. But because if YouTube and somebody is hearing this out, in Indian population, the alcohol
Yes, sir.
consumption does not give the benefit which the Western population gets it. So
Understood.
alcohol smoking, strictly no, no, no.
Yes. Sir.
Anybody else, any questions?
Yes, I think there's a question in the chat that they want more information on proton therapy.
Yes, please go ahead.
Yes. Sir. So proton therapy is actually a type of radiation therapy, only what I was telling you. The regular radiation, what we give is with the help of high energy, high power X-rays. So what happens is when there is a tumor and you radiate the tumor, the X-rays come, hit the tumor, and then they have an exit dose also. So even though with the latest technology, we try and keep the maximum amount of dose to the tumor, there is some shortage of spillage that happens in and around the tumor, which causes some of the side effects. That depends on the type, the area that we are giving, of course. So when it comes to proton therapy, and when we radiate the tumor with proton therapy, this is particulate therapy that we're actually using protons to treat the cancer. So these protons, what they happen, they come and deposit directly in the tumor, and then they don't have any sort of spillage that a regular radiation has. So because of this avoidance of spillage, the amount of side effects that you get with proton therapy are very minimal when you compare it to the regular radiation. The problem with proton therapy right now, one more thing I want to add is proton therapy does not improve your chances of survival. Does not mean that just because you get proton therapy, you'll have a higher chance of cure. The chance of cure is the same as proton and the regular radiation. What advantage that you have is only in terms of side effects. The problem with proton therapy right now is the accessibility. There is one in Chennai Apollo that we have. That is only one in Southeast Asia. And the second thing is the cost. So right now it costs about 30 to 35 lakhs for treatment, whereas a regular radiation would cost you somewhere around 4 to 5 lakhs. However, for us, for Indian population, you might say 35 lakhs is a lot, but it is still actually 1/3 the cost of proton therapy in Europe or US. So we have patients who come from Europe, stay here for about a month, literally come in a business class ticket, stay here in a 5-star hotel, get proton therapy treatment, and it still becomes cheaper for them.
Thank you for that information, Dr.
Thank you, sir.
Vijay. Yeah. We have someone from the audience. Please go ahead.
Yeah, thank you very much. And may I know, I'm Dr. Kavita here. May
Yeah,
I
ma'am.
know where the proton therapy is available in India?
Apollo Chennai, ma'am.
Okay, sir. Thank you. Only Apollo
Yeah.
Chennai or any other centers in India?
No, in India, Apollo Chennai is the only one. So any cancer patient who wants proton therapy, even if they come to us in Hyderabad, we because I have trained in proton therapy, what we do is we take the patient along with us to Chennai, and we are there through the planning process, and we visit the patient every week to see how the progress is, and we take care of them by ourselves personally.
Wonderful, sir. Thank you very much, sir. Thank you.
Sure.
Hello, Dr. Karan. Dr.
Yes,
Vidya
sir.
Sagar.
Hi, sir. Hi, sir. How are you?
Hi. Just to add one more thing, like it is not necessary only smoking and alcohol causes oral cancers, but I have seen few of my patients, my friend's mother itself, where she had a small ulcer because of a sharp tooth. So
Yes,
any ulcer on the tongue for more than 20 days, which is not healing, better we need to treat it as a cancer itself.
Yeah. Definitely, sir. Non-healing ulcer in the cheek or tongue is one of the very common signs.
One of the commonest things with no other comorbidities like alcohol. Things.
Yes, sir. Yes.
That's very good presentation, Dr. Karan. Thank you.
Thank you, sir. Thank you, sir.
Thank you, Dr. Vidyasagar sir, for adding that point, and people would be aware of it. And thank you, Dr. Vijay, for giving such an insightful information. Any more questions from the people joined here today? Okay.
Do we have next speaker ready?
So we are finished for today. So
We're
we
finished
want you
for today.
to
So, okay.
continue
Yes,
with this.
I would want to conclude is number one is a lovely talk by Prashant, because the numbers of autism and ADHDs are increasing. Thanks for that. We all can reach out to Utage Clinic, which is available almost everywhere in Hyderabad and Maharashtra. Very, very meaningful talk by Dr. Satish. I would want to leave it here for my audience. Doctors live 10 years lesser than the normal population. It's just because they work hard for you, number one. If they're sounding commercial, I must tell you, 99% of the doctors are very, very bad orators. So it's not that they're bad doctors, they're bad orators, which communicates a wrong message. Trust your doctor. If you cannot trust him, move on to somebody else. Third thing is our presentation done by Dr. Vijay Karan Reddy was fantastic about the cancer. One fact which you need to remember is 80% of the cancer which is diagnosed in India is in the last stage. And in Western population, 80% of the cancer diagnosis is in early stage. Come early to a center, to a doctor, so that we can give you a long life. Be scientific, stay scientific, and have a healthy and happy life. I would like to leave an acronym with you, HEALTH. Please remember, it's World Health Day. H is happiness always. Stress kills more than anything else. E is exercise regularly. You want to live longer? 100 minutes of exercise per day is needed. A is appropriate eating. You need to watch out what you're eating. Eat less to live longer is the dictum. L is, yes, listen to your doctor, listen to your spouse, and listen to your people who would want to guide you to the right side. You can be absolutely normal and you can have a cancer developing in your body. T is the TSH. TSH, sugar. These are anemia. These are the common diseases which kills the majority of Indians. So please, for all the women, check TSH once in 100 days, sorry. And men to check for TSH once in a year, because very common undetected disease is thyroid. And finally, H is have a regular health checkup, whichever hospital or clinic you're comfortable with. This World Health Day, as we conclude, we would want to tell you that we want you to live for 100 years and plus. And that can be only done through proper trust and faith in the science, as well as in the prayers and the well-wishers around you. May God bless you all. We are very happy that you all have joined us for this sessions. We will be very happy to take any more questions and to add it up to on the comment section also. And a very, very big thanks to none other than the Dr. Garima, who has taken this lovely initiative of bringing all the doctors together. We will close it here, and tomorrow we'll meet again at 5 o'clock with a wonderful session by Dr. Anand, Dr. Shrikant,
So
as well as Dr. Shruti and Dr. Sharmila. Now, already the people are set up there, and we'll be adding more people for your convenience. Anything else to add up, Dr. Garima? Because
the 4 o'clock. 4 o'clock.
Tomorrow 4 o'clock, sir. Tomorrow 4 o'clock we meet again for the World Health Day discussion on 7th April. A good day to talk about good health on a Good Friday. Take care. God bless. Goodbye.
Goodbye. Thank you. Thank you so much, sir. We are closing for now. Thank you.